you for joining us this morning. I just want to share the agenda briefly and let you know how the day is going to go. Obviously, we're doing the welcome today right now. I'm going to give a really brief rundown of some of our conclusions from the 2020 report to kind of resituate everybody and what we talked about when we released the report back in June. And then we're going to move to the breakout group discussion. They're going to probably be relatively large breakout groups because we have a lot of folks today, which is really great. And Kinder Institute researchers are going to be facilitating those and getting input from everybody. And then at the end, we're going to be joined by Stephen Dow, Chrishelle Palay, and Anna Rausch for our panel. And we'll get everybody back out of those breakout rooms in time for the panel. We won't start until all the breakout rooms are back. But we're really excited for the full day. At any point, you feel free to keep up with us on the conversation on Twitter, where the Kinder Institute is at Rice Kinder Institute, Kinder Inst. I'm at Kyle K. Shelton, and we're using the State of Housing hashtag. And before we jump into the summary, I want to welcome Alan Larkin from Wells Fargo. Wells Fargo was the underwriter supporter for the 2020 and the 2021 report, and we really want to thank them for their support. And I want to ask Alan to join me in the Zoom spotlight and welcome everyone this morning as well.
Okay, thank you. Thanks so much for the kind introduction and to everyone and for hosting this webinar / workshop. This is a fantastic opportunity for all of us to learn more about the state of housing in our great city. Again, as Kyle mentioned, my name is Alan Watkins. I am the Senior Community Development Consultant for the Greater Houston area, and I welcome you to the State of Housing webinar for Harris County and Houston. We are so proud to lend our philanthropic support to the research that the Kinder Institute is leading to identify and address housing issues in our great city. The work that is taking place with the State of Housing program aligns with one of our key philanthropic focus areas, housing affordability. Affordable housing plays a vital role in helping building strong, healthy, striving, stable communities. And we understand at Wells Fargo that America's housing affordability crisis isn't restricted to cities on the East or the West Coast. Families everywhere are sacrificing necessities like food, healthcare, and education in order to afford a place to live. We are grateful for reports like the inaugural State of Housing that help shine a spotlight on what's happening in our own communities right here in Houston. We know that affordable housing is a huge undertaking and it takes a village to create. At Wells Fargo, we do more than just talk about how important affordable housing is, we act. We have partnered with so many community-based organizations over the years here in the city, and that's why the Kinder Institute is an important partner in addressing our local housing needs. We applaud the entire team at Kinder Institute, including Bill, Evan, and Kyle, and so many others for this important research that will serve as a benchmark as we collaborate to address housing affordability. We're looking forward to hearing from the panelists, including Anna, Stephen, and Chrishelle later in the program, and community leaders like yourselves in the workshops across this great city and moving the housing conversation forward. We have made tremendous progress, but there is still quite a ways to go before we can say that everyone, every individual, and every family has a quality and affordable place to live. Living in my childhood home currently in the historic neighborhood of Kashmir Gardens, I know firsthand how some of the housing challenges that our communities face. And that's why the data that the Kinder Institute produces is so important. And so that we can have a broad perspective and a broad understanding on the state of housing in our region. And Wells Fargo is proud to partner for the 2020 report and keeping the conversation going today.
Thanks, Alan. Appreciate that. And thanks again to Wells Fargo for your ongoing support of the study and the work. So the purpose of the State of Housing report has been to establish a baseline of housing data across more than 60 key indicators. And part of today's conversation may be that we want to add more. There may be other information and data that you all tell us you want to hear about and see tracked. And so the goal of the report is to bring that in a consistent way every year. We think that having that really important baseline is critical to informing, as Alan was talking about, not just our policy and development goals, but the overall effort to house all Houstonians safely and affordably. Part of what the Kinder Institute always tries to do is to make that data available to all, not just to public officials and supporters, but also residents, community members, other researchers. Our goal is to bring the information that we're creating to as many folks as possible to help understand the situation, to help level set and educate folks about what's happening within housing, and to help solve the issues. And then also this last bullet point is particularly salient for today. We want this to be a really responsive report. We want it to be something that we can update and make more timely and make more useful for all of you. And that's the goal of today. We wish we could be there in person with all of you, having really in-depth conversations, but we appreciate everybody being flexible and doing this virtually, obviously with lots of unknowns around coronavirus and the challenges that it presents. But we're really excited to still have the opportunity to do this today and to learn from you all about what else we can do with the report. So just briefly on some of the key findings from the 2020 report, what we found was that Harris County's reputation as affordable is declining. Both housing prices and rent prices are going up and have gone up considerably since 2010. And as a reminder, for the time frame we started, the 2020 report looked back at 2010 and then compared it to 2018 data, because that's the bulk of the census data that was available. So the reputation the county has and that the city has as being a affordable place is on the decline, which has created a difficult situation even for median income households. Lots of the households who we would expect to potentially be moving into home ownership and purchasing a home for the first time, that's becoming more and more difficult within the city of Houston and Harris County. The challenge is most pressing for low-income renters who are facing really significant hurdles sort of in all directions. Not only do households have low incomes, but they're facing escalating rents in many, many neighborhoods, and a shrinking supply of affordable housing, both subsidized and naturally occurring affordable housing, just market rate affordable housing. Black homeownership rates have also declined more than other racial and ethnic groups, and there's a variety of reasons for that. It stems all the way back to the Great Recession, when Black homeowners had bigger issues with mortgages and foreclosures, and recovery has been slower, but also is tied into issues with income and historical issues such as redlining and elements that contribute to the creation of the racial wealth gap. So that's something that we're certainly tracking and want to be paying really close attention to. And also something that we all know is a clear and present challenge for Houston and Harris County is our ongoing risk for flooding. And in our report, we highlight that 1 in 4 homes was at risk for flooding. So I'm going to just go through a few slides before I set up the breakout groups and we get to you all and hear your thoughts from these key findings. I just want to kind of illustrate some of what I've talked about. As I mentioned, housing prices are growing really rapidly. So these are median sales prices from HAR. So it's not just the estimated value, the appraisal value, it's actually the sales price. And what we see from the sales price is that they have grown very quickly. So almost 40% in Harris County since 2010. And the median sales price in the city of Houston is about $50,000 more than in Harris County. So it's a pretty significant difference. And as I was saying, the affordability level the affordability is declining overall because these prices are going up. That's obviously a boon for current homeowners, but again, is a challenge for those who are trying to enter into the ranks of homeowners. And then at the same time, as I mentioned, rent is growing. The median gross rent went up by about 8%. This is also significant because with the challenge of folks not being able to move into homeownership, there are more and more renters. And so what we're seeing is the prices of rental units are going up. Many of the units that have been built or many that have been renovated are higher priced units. And so there's a lower supply of units available to households with lower incomes. And as the population of renters continues to grow, what we're seeing is a really big squeeze on renter households that are on the lower side of the income ladder, because there are more renter households trying to find homes, trying to find affordable units, and they're squeezing that whole supply. And folks who are often then finding themselves at a disadvantage are also the most vulnerable families and households that have the lowest of incomes. And this is just another illustration of that affordability gap and the loss of affordability. So if you look particularly at the blue, this is the affordable housing price, the blue column from 2011 on the left and 2018 on the right. Blue is the affordable housing price for a median income household. So in 2011 in Harris County, a median household could, a household with a median income, could more than afford the median sales price of $139,000. But by 2018, you can see if you track that blue column over, that the median income, a household with median income now has a gap, is now below being able to afford a median priced home. And so this is what we talk about when we are talking about the loss and the inability of median income home households to move into homeownership. The gray column is the other one that I would draw your attention to. That is for median income renters who have an even lower median income level than homeowners as a household. When we compare across households, renter households have lower median incomes. The gap, as you see in 2018, is significant for renter households. There's a huge gap. There's a huge hole in their ability to move from renter to home ownership because the sales price has grown so much and the median income has only grown a little bit. Another way that we see sort of the tightening market and the impacts on households is cost burden. And this actually relates back to the last slide as well in terms of what folks can afford and what housing is affordable to different households. Most research and most most of the housing sector world uses a definition of 30% of a household's income being affordable. Obviously, that means really different things to different households. So if a household makes $150,000, 30% of that household's income is a big amount of money, but takes a different impact on the rest of the household's finances than if you are a household that makes $40,000 and are spending 30% of that income on your housing. By most definitions, if you spend more than 30% of your income on housing, you are considered cost burden. And there's a even deeper level of cost burden called extremely cost burdened, which is if you're spending more than 50% of your income on housing. In Harris County, this is a major challenge. As you can see here, the top graphs here are from 2010, the lower 2018. For homeowners, the situation has actually gotten better. Again, this is, if you think about 2010, we were just sort of ending the beginning of the end of the Great Recession, and homeowners are beginning to recover, or the nation was beginning to recover. You can see that obviously homeowners have rebounded to a pretty good extent, and that the trend in 2018 was looking good. We'll have to see how that goes with COVID. Obviously, it made lots of complications for lots of folks. But prior to COVID, homeowners were seeing a reduction in the amount in the number of folks who were cost burdened in Harris County. For renters, however, the percentage stayed very static. So the same percent of renters, just under half, were spending more than 30% of their income on housing, both in 2010 and still in 2018. And again, that's a testament to the fact that the supply has shrunk and that prices have gone up, and that incomes have not grown for renters in kind. So that many renters are still spending an unsustainable amount of their income on housing. And it is, I had a longer slide that I removed from this one because I forgot I was doing the shorter slides. So what I will say about this one is that it is particularly problematic for the lowest income households. So almost 70% of folks who make less than $50,000 are spending more than 30% of their income on housing. So again, if we think about the problem of cost burden, the biggest challenge there is that for those families who have the lowest incomes, when they're spending 30, 35, 40% of their income on their housing, on their rent, or on their mortgage, that means they have much less available for education costs, healthcare costs, transportation costs, general recreation, and everything else we do in our lives. And so given that housing is is among the major costs of a household, the more we can do to help put people in sustainably affordable units and that fit within their budgets and find ways to support families of low income, we also create more opportunities for them to use their incomes on other needs. Also, as I mentioned, declining homeownership, particularly for Black homeowners and for Black residents. You can see that the rates of homeownerships for Black residents in our community are far lower than all the other major racial and ethnic groups. And again, this is rooted into a number of factors, including the racial wealth gap, including the slower recovery from the Great Recession, but also from ongoing hurricanes and other disasters, which research has shown that Black and brown communities are recovering more slowly from. So a lot of factors contribute to this, but it is definitely an important piece to continue to track here and to think about how we help support Black and brown homeowners and ensure that they're able to create wealth on par with their white neighbors. So that's the quick overview. Again, I want to encourage everyone to reach out at any point with questions about the research and about the report. We're always available to work with individual communities, individual entities to sort of talk about what our research is finding and how it relates to your communities. There is a lot more in the report. If you didn't join us in June and if you haven't had a chance to really dig into it yet, I would love to suggest that you please do that. So for the end of our time today, we're really glad to be joined by Stephen Dow, the Executive Director of the Houston Office of Local Initiative Support Corporation, Chrishelle Palay, the Executive Director of the Houston Organizing Movement for Equity Coalition, Home Coalition, and Anna Rausch, the Vice President of Programs Operations for the Coalition for the Homeless. Thank you, all three of you, for joining us today. What we wanted to talk through and think a little bit about, when we did the rollout in June, we talked some about how we were seeing the impacts of COVID and the economic impacts that were coming from the pandemic and the consequences of the pandemic. All three of you work in housing directly and work with really vulnerable households and on topics ranging, from homelessness to evictions to finding housing stability. And I'm just curious, what we really want to do today is sort of get from your perspectives, what are we seeing and what trends and what patterns have we been observing? What are some of the new challenges we're confronting as we are in what feels like month 96 of the pandemic, but I think what is month 8? Why don't we start there? What are you guys seeing in your day-to-day work and your experiences with your clients and colleagues around housing stability? How has it changed in the past 8 months? What are we seeing? And feel free to either wave or just unmute yourselves and jump in.
Sure. So I'm not sure if everyone who is familiar with the Home Coalition, but basically we're an organization that was founded and created while Hurricane Harvey was actually churning over Houston Harris County area. And so what we do is we really try to center directly impacted communities, specifically low-income communities of color, at the intersection of housing, infrastructure, environmental justice issues, labor issues, job issues, and disaster responsiveness, period. And so typically these are communities and populations that have already really endured many challenges prior to Harvey, and Harvey just exacerbated those conditions. And so when I look at how we see housing instability rather in our work, it's this two silos in the sense that we're kind of standing in the middle of. The organizations that comprise the Home Coalition are mostly organizations that work directly with communities that are impacted. So folks who are still in need of Harvey repair, many people who still have not fully recovered from Hurricane Ike. Then of course you have COVID on top of that. So folks who are, when it comes to their health, already very vulnerable. People that are typically essential workers. And so they have exposure, potential exposure there. So, dealing with those and trying to address those issues immediately, because those are real relationships that we have. Then in the other silo, we are steeped in this world of ongoing research and policy analysis. And so we're kind of standing in the middle trying to, figure out how we can pull the gap together. Because it's really, really hard when we know that Ms. Jones really needs Harvey repair, but she likely can't qualify because she owes back taxes. Sure, she could arrange, a payment plan, but she knows she doesn't have the dollars to actually pay the payment plan. So how do we do that? Then on the other hand, we know that there's ongoing research about what are some ways in which we can really address property tax delinquencies, aside from just them becoming part of land banks and and homes being lost. How do we speed these things up? So home really finds itself oftentimes right in the center of the issue and the longer research processes that it takes to actually get to solutions.
Stephen or Anna, just general observations right now from your work, either building on what Chrishelle said. I think that great point about how do we address human needs and immediate needs while also kind of having a farther horizon, thinking about policies. What are you guys been confronting and seeing in your day-to-day work amidst the pandemic and the recession?
I think that we've actually been, obviously we deal with the homeless population, so individuals experiencing homelessness, and we've actually been very lucky in the sense that I think we responded early on to the pandemic and to try to put some measures in place to keep individuals experiencing homelessness safe from the pandemic as much as possible, because we know that people that are experiencing homelessness are very susceptible to underlying health conditions, which make them more susceptible to contracting the virus. And if they get the virus, they're about twice as likely to develop pretty severe symptoms and even death. And so we put a lot of, auxiliary sheltering and hotels and medical isolation facilities in place so that our existing shelter partners could have space in their shelters for social distancing. And then, moving people around so that they're not all crowded into shelters where the cots are next door to each other. We actually haven't had a lot of outbreaks, knock on wood, amongst the homeless population compared to other cities. I think currently the medical isolation facility, the hotel that we have set up, has been probably under 300 people that have gone there. And some of those individuals were precariously housed, not necessarily homeless. And so, and then we got to the point where we are also allowing individuals that were, doubled up and couldn't go back to the facility they were residing in so they wouldn't spread the virus. We obviously won't know the full impact until we do our homeless count in a creative way next year. But we have put some measures in place, and we can talk about that later on during the discussion about what we've been doing to kind of try to mitigate some of the issues that we see might happen amongst the homeless population moving forward. So.
I muted myself. Thanks, Anna. Stephen, any sort of initial thoughts or observations from the work LISC has been doing and that you all have been doing with colleagues?
Yeah, I mean, I would just sort of say, I mean, as an intermediary, we don't have that direct experience. I think ours really comes through the support that we do with the Go Neighborhoods work and the financial opportunity centers, in which I think the themes that both Chrishelle and Anna have laid out we're just obviously seeing people who are very short on funding to meet their basic needs across the range of that. And so, so that I don't think I have a whole lot more to add than that for this part of the conversation.
Sure. So maybe as a follow-up, Stephen, I'm curious, and this can then sort of apply to everybody as well. What changes have you seen within the services you're providing? So Stephen, you mentioned Go Neighborhoods and the financial opportunity areas, or just how you're interacting with your clients and collaborators. What needs are sort of rising to the top? How have you adjusted? I mean, Anna, you mentioned some of the programming you guys have already done, but are there other steps that you guys have taken to be more responsive to clients at this time, or sort of what questions are rising to the top of the normal work that you've been doing?
To me, we're like in monitoring mode, I think, at this point. I'm not hearing a lot of people complaining that although our shelters are not at capacity, obviously we can't be because of the pandemic and social distancing requirements. We're not at the coalition because people usually reach out to us primarily when they're looking for shelter. We're not seeing a lot of individuals seeking shelter and being denied across the board. Obviously, the unsheltered population is starting to look a little differently. We now have an outreach team with the coalition, and we're seeing people kind of moving amongst the community, mostly to try to be near service providers, because there are a lot of service providers that have kind of shifted their way of servicing individuals because of the pandemic. So some are not helping as many and not letting as many people in buildings. And so I think we're seeing individuals kind of shifting where they're living across the community, the unsheltered population primarily. So we're trying to do as much as possible to get those individuals assessed for housing, because there's going to be some opportunities coming online this month to make a really significant impact. And so I think right now we're just in that monitoring phase and trying to engage with individuals as best as possible, being safe, providing equipment for our outreach partners to be able to still interact with clients in a safe way. Our partners are still working remotely. We're working remotely, we're probably going to do that for a while. So it's kind of like a fine line that we're walking on trying to serve people and still stay safe during the pandemic. So.
Yeah, I guess I'm just, continuing to kind of talk about the pandemic. I think that's one thing that another layer that's, that's been placed on these community members to try to navigate. So again, many of the community members that are the most vulnerable were already suffering prior to the pandemic even being here. So we see, of course, a lot of loss of jobs or a decrease in hours, folks still needing assistance. On another level, I feel like, we also are suffering through like flooding PTSD. We have, many community members that, we know that the infrastructure specifically in many communities of color has been inadequate for far too long. And so they are seeing the impacts of this in a much quicker now than what has been in the past. And then also just being able, these same community members being able to receive information and know what resources are even out there. So you have a lot of people, a lot of community members that are just trying to figure out ways to get these issues dealt on their own. A lot of folks don't even know about some of the resources that are out there. So home members are often, trying to do, one-on-one, well, the members of home, let me be clear about that. The members of home and their organizations have been doing a lot of one-on-one calls and things like that. But because of COVID, of course, trying to do it in a safe manner. So, spending a lot of face-to-face time, which is what many organizations have done in the past, is not happening like it used to. So just trying to overcome that barrier on top of everything else.
Thanks, Chrishelle. Stephen and Chrishelle, you both are on the Housing Stability Task Force, and eviction has been a really big issue for Houston and for the nation right now in COVID. I think folks have been paying attention to it and there's been a lot of coverage of it, but I also think there's just been a lot of work happening and a lot of issues being addressed. Can you guys tell us a little bit about the work that you guys have done for the task force, what some of the things you're trying to work on and address are? And Stephen, maybe start with you.
Sure. And I was also just going to say Anna is also on the task force.
Oh, and I'm sorry. I knew that the coalition was represented.
That's okay.
It's a group this size when you look at the Zoom meeting, so it's hard to remember.
Stephen and Chrishelle are great at it, so it's fine.
No.
Sorry about that. I'd love to hear all three of your perspectives on the task force.
Yeah, so I will say, I think one of the things that we've sort of really wanted to make sure is that the task force was comprised of people who had various perspectives on the issue, but also were really focused on this as a key issue for them. And so at the outset, we really were operating in a bit of a reactive mode when we first were established. I think there was a huge amount of effort on wanting to help understand of the resources that were coming to the city and the county, what were the best ways of getting those resources out to the community, and what specific outcomes or populations and methodology should be utilized. So one of the first big pieces of work that we did is comprise several different working groups. One that was focused on policy, and that group very quickly aligned around the idea of recommending to the city the policy that was to create a grace period. That policy recommendation, notwithstanding the fact that it was endorsed unanimously by the task force, was, as everyone knows, not embraced by the city leadership, and so that did not happen. But I think the rental assistance working group that was created really wanted to think about how best to design the rental assistance programs, and came up with a set of recommendations and principles, which then were forwarded both to the city and the county. The biggest one, I think, and the most impactful of those was that the city and the county actually coordinate their services and try to operate in a more unified way in the community, which I think they have made great strides at doing, which we were, I think, very pleased to see. The other area that we established was something that we did in response to an initiative that Commissioner Ellis had around trying to provide a right to counsel for people going through the eviction proceedings. That working group and that idea was expanded to include not just the right to counsel that is being led by Lone Star Legal Aid, which is also a member of the task force, but broadened to think about other elements in terms of both a much more proactive education effort for both tenants and landlords, as well as trying to change the way at which the relationship between the landlords and the tenants happens, so that we can begin to facilitate conversations between the two prior to an eviction filing. So really trying to move some of our efforts, what we've termed upstream. And then the last working group that we have established is one that is very focused on smaller landlords and landlords of color. I think that there is a big concern that a sizable chunk of the rental housing, particularly that's the most affordable, is owned by smaller landlords who are not often represented and who are experiencing significant rent collection payments. And the sort of risk is that their properties fall into disrepair quickly. They potentially go into foreclosure. That presents an opportunity to have those properties land in the hands of opportunistic buyers. And we clearly saw that happen in 2008, and that then really impacts that housing long-term, and it also immediately impacts the tenants in those, because of the fact that those tenants essentially become subject to almost nearly automatic eviction. And then the last thing that I would just say is that we've really been trying to grapple with what I would call the unintended consequences of the CDC moratorium, and really wanting to understand better how that's playing out currently, and I think most especially how that will play out when the moratorium is lifted. me stop there, and I think both Anna and Chrishelle have additional perspectives.
Can you hear me? Okay, yeah. So I guess one of the things additionally that I would say is that, while Stephen definitely laid out all of the work that's being done, I'm so glad that that the soil in a sense has begun to be tilled, because we're starting to uncover and realize what some of the other underlying issues and challenges definitely are. I think before even getting going, we understood and knew that there is really not enough money to throw at this to really sustainably fix the problem. And so it's going to have to really be some real thought, and also, self-interest on all parties in a sense to really come to a solution. Because right now we look at the relief funds, it really in essence is a lottery system by which people that kind of get the golden ticket, they only, and honestly they get a sigh of relief for a month or two, and then they're back at it again. And then Stephen also mentioned, come January 1, we are facing an eviction cliff that we really have to deal with, and know that what the potential consequences of that will be. And he also mentioned the moratorium, the CDC moratorium, where there are definitely gaps and a grave failure, honestly, to really enforce it. And the bottom line, I feel like, is that people still don't even know that these resources really exist, or there are even potential resources. I know that it was recently discovered or discussed in one of our prior meetings that although there are legal resources in place, but there's such a small percentage of those who are showing up to eviction court that are represented. And the folks that are going to eviction courts are likely the ones that really could qualify to be clients of Lone Star Legal Aid and other pro bono type of attorneys. But they just don't know. They don't know how to even navigate that process. So this task force is definitely unearthing a lot of issues that I think on the surface we knew existed, but now they're coming up real time for us.
Thanks, Chrishelle. Yeah, I think that idea that we know that the crisis of COVID and the economic impacts that are having are really amplifying a lot of the pre-existing issues, right? And challenges that lots of households faced before that, but also opening that to an opportunity to say, how do we deal with this, not just from COVID and its impacts, but at a bigger picture. So thanks for highlighting that. Anna, any thoughts about the task force or the work it's doing and how it overlaps with work for the unhoused? Or?
Yeah, I mean, it's been very interesting being a part of that group. I've actually learned a lot in regards to the eviction prevention, options that are out there. So it's helped even some of our clients that we've housed over the years. And I will say I've gotten some ideas on how to best work with the Lone Star Legal Aids and Beacon Law and those organizations to kind of, partner with them in the next 2 years for our own housing plan that we're rolling out to see if we can, avoid some of those evictions that would lead to homelessness and, entry into the homelessness response system, which we want to avoid. So it's been really great, actually.
And while you're talking about some of the programs and planning you guys are doing, will you also share with the audience some of the steps you guys have taken with your the funding that was given to the coalition for the broader plan and broader efforts? I think not just tied to COVID, but also looking forward. What are some of the steps you guys are taking?
So we're really excited. This month we are rolling out our community-wide COVID-19 housing program, aka CHIP. We love acronyms, so that's what we're calling it. So CHIP is going to target about 5,000 people experiencing homelessness over the next 2 years to limit the spread of the COVID-19 virus. So I mentioned earlier that people that are homeless and get the virus are twice as likely to be hospitalized, 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die than others in the general public. So really for people experiencing homelessness, housing is healthcare. So the 3 biggest components of the CHIP plan is the first one is going to be what we're calling a bridge to permanent supportive housing. So for those individuals that are experiencing chronic homelessness who may currently be living in an emergency shelter or primarily on the streets and encampments, it will involve providing them with housing, rental assistance and subsidy until an existing permanent supportive housing unit becomes available through natural turnover in our continuum of care, Another way to think of this is that we'll house in 1 year the number of people we would usually be able to house in permanent supportive housing in 2 years, because rather than having them wait like on the streets or in shelter, we'll be able to house them immediately with this rapid rehousing bridge. So this is part of the CARES funding that came in through the CARES Act into the local jurisdictions, so like the city and the county. The second thing that we're doing is rapid rehousing for about 1,700 individuals that may fall into homelessness as a result of the COVID pandemic. So individuals that may have become sick and lost income, or maybe they just became unemployed because of the pandemic. So those are the ones that we're targeting with 12 months of rental assistance and light case management to get them back on their feet. And then the last thing that we're doing is diversion, which is rapid resolution. It's called different things, but it's really about preventing individuals from entering the homelessness response system. So, you know, there's been so much data out there about evictions and individuals that are precariously housed. And so we want to target the group that are kind of, you know, not really needing that eviction prevention, but really they're needing like a temporary and quick resolution to prevent them from entering the homelessness response system, which is what leads to an increase in first-time homeless numbers, an increase in the returns to homeless numbers, which can impact the funding that comes into the continuum of care. So for the diversion piece, that's really what I've used and learned from the Stability Task Force, the Housing Stability Task Force, on how we can work with some of those legal aid partners, or even some of the strategies that those agencies are doing in providing the assistance, on how we can kind of tailor that to fit that niche group that are experiencing that immediate housing crisis where they can't return. So we're looking at it like if someone had a place to stay last night, but they may not have a place to stay tonight, and the reason why, and if we can connect them back to that place to stay immediately rather than them coming into the shelter. So we're really targeting those individuals at the front door of the homelessness response system. And I think this is the most exciting piece of the CHIP plan because it's brand new. It's a pilot for us. We've never done it before. But there are, you know, cities like Los Angeles and Boston that are doing it very effectively, and they're able to divert, you know, quite a bit of people from entering the homelessness response system, often with just a conversation. So like conflict mediation, not really even a financial assistance package. So we started this month. We're getting our partners on board. We're very excited because we want to make sure that these individuals that are experiencing homelessness or may fall into homelessness because of COVID don't get the virus, and we keep them safe as much as possible. So yeah.
Thanks, Anna, for describing that. Something you guys have each sort of touched on that I'm a little curious to see if you can expand on or think of other examples of. Obviously been in response mode, right, to a great extent to COVID and the consequences it's causing. But something that's always important to do in these crisis moments is also think about what are the lessons that we're learning or the things we're highlighting. Chrishelle, as you said, what are we overturning that we know need to be a part of our ongoing sort of, fingers crossed, non-crisis moment? What are the things that you all, and I know you already talked some about the programs you guys are putting into place longer term. What are other examples of lessons that you all have encountered or elements you want to see us not just use right now to try to respond to COVID, but to actually incorporate into our system going forward or into our thinking going forward as we try to sustainably and stably house everyone in our region?
Well, I can mention a couple of things that we're sort of exploring. I mean, one is, I think that especially with the work that Connective has done and Elena White as a result of administering the technology for the rent assistance program that's been handled by both Baker Ripley and now the direct assistance program that's being administered by Catholic Charities, and the previous work of the funding that had been allocated from the county and then went through the Greater Houston Community Foundation. They've collected and done focus group work with both landlords and tenants. And I think it's probably not dissimilar from what Chrishelle shared with us and others have said in terms of the actual process by which agencies operate to make the system for people who need help user-friendly probably presents an opportunity for improvement in terms of people really knowing where to go, being able to get the help before it's a crisis. So for example, most of the rent assistance money that's available in the community requires that somebody have a notice to vacate before they can get assistance. So in essence, even though we know that early intervention and prevention is the best way to avoid significant consequences, the existing dollars are structured in such a way that it incentivizes the behavior at that point rather than earlier. So I think that's an example of something that I think we're really trying to figure out whether or not there would be a way to reimagine. Similarly, just, you know, when people are at their the end of their rope and need to try to figure out how does the actual eviction proceeding work. I think there's a great deal of consternation about that, as well as the specific situation with respect to the moratorium or the CDC order that's in effect. So that difficulty that people have of really understanding what they should be doing. And just one quick example of that, and then I'll let Anna and Chrishelle weigh in, is the CDC order requires that tenants actually fill out an affidavit in order to be able to claim the protections of the CDC moratorium or order. And most of the data suggests so far that they have no idea about that. So
yeah,
those
I would definitely agree. I would definitely agree on that. I think that even with our own clients and people that are contacting the coalition for rental assistance, we have spent a great deal of time, the people on our staff have spent a great deal of time translating these eviction moratoriums and the various ones that have come out, right? So that we can better explain it, not only to our case managers, so that they can then explain it to their clients. So I think that one of the, and it's been talked about in the task force as well, I think that one of the things that I would like to see, or lessons learned or whatever, is some type of education. I know that, like, tenant education, and I know that a lot of landlords, there are some great landlords that are working with people to try to do that themselves, but it's so complicated, you know, and it's definitely something that we need, across the system.
So I guess one thing that I would add is that as we navigate these waters, one thing that is clear is that the responsibility of eviction has primarily been placed on the tenants. And so I would, definitely say that as we are, trying to figure out what the solutions are, that we change our lens by which we're examining these problems. It's the tenant's responsibility to file for the CDC moratorium. It's the tenant's responsibility to seek out legal assistance. It's the tenant's responsibility, and I can continue to go down the list. Now, I'm not saying that there are no requirements when it comes to landlords, but by and large, you always hear about the responsibility of the tenant and how they did not act in. So we just really, in my opinion, just need to really shift the way that we're talking about this, the way that we're seeking solutions. And sure, I know that there are other areas where, there have been some pilot programs that have been launched and things like that. And I'm sure that there are, there definitely been some highlights as far as some successes, but we still have not seen a systemic solution to the issue. And so we have to change the way we're talking about it. We have to change the way that we're even thinking about it. And I think that part of it is definitely shifting and not making it on the sole responsibility on the tenant to act to fix the problem, where we're not really talking about what is required and not necessarily what is required of landlords, not necessarily what we hope that landlords do.
Thanks, Chrishelle and Stephen, for that. Those thoughts. I froze there at the end. If I freeze again, I apologize. Get right back on. The joys of the internet. I think my last question for you all today would be, in the spirit of the workshop as well, what are things that you all wish what are data points, what's information, what are elements you wish we had the ability to know and track to help address some of the issues that you guys have talked about and that we're confronting each day? What are some of the things you just wish, if in a vacuum, if I could know this piece of information, it'd be incredibly valuable?
I think it would be an interesting approach to recognize, so I'll just use the word survivors of, disaster, survivors of COVID, and really center their experience as a baseline for expertise. I think oftentimes, of course, folks who are experiencing those issues on the front lines, they're talked to, they're interviewed, but it's looked at more so as a case study. So I think it would be interesting flipping it and using their specific experiences as expertise, and then perhaps validating it with data as opposed to the other way around.
That's a great idea, Chrishelle. Thank you. Stephen or Anna, ideas of what data gaps do we have that we wish we knew how to track and how to answer?
Yeah, I mean, I would say one of the things we're really struggling with right now is to really understand what's going on. I think, if we go back to the very beginning in terms of when we first were established, there was a big concern that there would be an enormous number of housing dislocations as a result of the expiration of the unemployment benefits. There was an understanding that the protections that existed in the federally subsidized properties were ones in which evictions were not going to be able to happen. But we really just, I think, have not, there does not seem to be solid data helping us understand, are people moving around, are landlords having their properties and rent collections so far compromised that they are not able to make repairs, that they're not able to pay the operating costs? Does it vary by geography in the community? Does it vary by property type? Does it vary by landlord type? So I think one of the hardest things in crafting a targeted, effective response is the lack of real-time data about what is really going on in aggregate. I think the other big concerns that we have that data is around whether or not, frankly, primarily as a result of the CDC order, whether we may see increased numbers of what I would call illegal activities on behalf of landlords that are not going to depend on the legal eviction process and use other ways of asking tenants and getting tenants to leave. We don't know whether or not leases are being renewed. If you just assume that the eviction moratorium only applies to people who have a valid lease, we don't know whether leases are being terminated such that the protections of the CDC order wouldn't apply. So I think those are illustrations of the real lack of data, real-time data that we need to be able to craft effective programmatic and policy responses.
And I think that's also a really interesting connection to what Chrishelle just said, which is, so how do we think about, creating focus groups and groups of residents as experts to answer those specific questions and really get into that. So thank you both. Anna, any ideas of things that we're missing or things that we could be trying to track?
So one of the things, and obviously we deal with the homeless issue, right? So one of the things that I would love to be able to track, I guess, is what truly leads, what are the group of individuals that will become homeless, that do end up becoming homeless, and why? There's not a lot of literature and data out there. I think the closest we've been able to find is that there's not really a specific thing that indicates someone will become homeless. There are a lot of people, like in our system, we've been able to pull a lot of data that shows that there are households that come into the system and receive one service and then leave and never come back. And so we kind of look at those as the self-resolvers, right? And some of the things that I've read, a lot of the literature shows that the closest to that we've ever seen is that if there's a household that has an eviction notice, for example, or is going to be evicted or needs some kind of homelessness prevention, if they've had one or more episode of homelessness in the past, they're at greater likelihood to become homeless. But you know, we need way more information than that, because if we knew what are some of the factors that actually contribute to some, because there's a lot of people that have some great you know, instincts and they're able to find help on their own, they go to a family member, whatever that is. But that in that initial panic mode, they're like, oh my gosh, I need shelter, or I need rent, or I need something. But really they don't end up, you know, becoming homeless. So it'd be great if we could have that information, because then we could tailor the interventions early on to kind of target that group. And, you know, maybe they won't need it, or they won't fall into homelessness.
Thanks, Anna. That's a great example. Extra credit to Yolanda, who just asked a question in the chat, the first question. Great work. And it's a really important one. And I wonder, Stephen, if you can touch a little bit, knowing some of the ins and outs on the task force programs, how have the task force programs been approaching the allocation of resources, and how do we make sure we're getting them proportionally to the places that are most highly impacted? And unfortunately, that'll be our last question, but I think it's a really important one to end on.
Well, I will say, you know, with the assistance of the Kinder Institute, that's been a terrific help. I think one of the things that I think Chrishelle noted before about the prior allocation of rent assistance dollars when the city did the first come, first serve effort back in May, is that there was a lot of concern that that was neither targeted to vulnerable populations sufficiently nor to specific geographic hard-hit areas. And so we were able to work with a tool that was developed while Connective and Baker Ripley had mapped out using the CDC's Social Vulnerability Index. The Urban Institute came up with a tool that was presented to the task force that incorporated additional real-time data around unemployment filings and other places around job losses. And I think, you know, the work, obviously, Kyle, that you and the team at Kinder were able to do to help us identify that and then make recommendations that the additional rent assistance be allocated more effectively, both to geographic areas as well as specific populations that were particularly at risk. Chrishelle and Anna, feel free to add to that. I hope that's responsive.
Great, thank you, Stephen. Well, thank you all so much for joining us as panelists today. Really appreciate you guys taking the time and sharing your expertise and adding to this conversation, and for joining us for the breakouts. And thank you to everybody, all the participants who are still here and audience members. This slide just shows if you have questions, no, ignore the Q&A box one, sorry, forgot to take that one out. But if you have more questions about state of housing work, about this conversation, about the community level data around the housing, this is at datahouston.org, or feel free to reach out to me directly. We're happy to work with community groups and organizations and stakeholders, try to share this information. So feel free to follow up there. We will send this presentation out to everybody who registered today. And then I also wanted to again say thank you to everybody for joining, giving feedback. Thanks again to our partners at Wells Fargo for supporting the state of housing work, and all of you for continuing to have conversations with us. I'm also in the email that we send to registrants going to remind everybody that the Harris County Housing Study is ongoing right now, and there's a survey live, and the Kinder Institute is running the program, running the project. There's a survey live now at myhomeishere.org that we would encourage everybody who's a resident of Harris County to take, to give us more information about your housing situation, what you want to see your neighborhoods look like, and how you want the county to approach its housing work in the next decade. So it's a really important other project going on in addition to the state of housing work. So we'll send out a link to that as well. And again, just thank you for joining us today. I hope everybody stays safe and finds ways to relax and recharge in this very trying and tiring time. And it's great to see you all, and thank you for your ongoing engagement. Take care.